And alarm in Vietnam as they detected a new strain of the coronavirus. Plus, the Ministry of Transport is also considering uh, plans to transport travelers left stranded in Da Nang. Eliana Faith Sebastian joins us live from Vietnam. Hello, Eliana.
Hi, Alma.
Go ahead, Faye. Eliana.
Oh, here are the new updates here in Vietnam. A new coronavirus strain has been recorded here in Vietnam. New patients suffering from COVID-19 in Da Nang City and Quang Ngai province are likely to have contracted the virus from different sources in the community, said Acting Health Minister Nguyen Tan Long. Speaking at a meeting with the National Steering Committee for COVID-19 Prevention and Control on Monday morning, he said genetic analysis revealed they were infected with a strain of SARS-CoV-2 new to Vietnam that is common in several regional countries. It is a more contagious strain, he said, adding that it's the sixth strain recorded in Vietnam. Experts at the meeting said the preliminary epidemiological investigations showed 4 COVID-19 cases in the community confirmed over the past weekend were linked to 3 hospitals in the central city of Da Nang. These health facilities are Da Nang Hospital, Da Nang Hospital C, and Da Nang Orthopedic and Physical Rehabilitation Hospital. An additional 11 cases announced on Monday evening were all linked to Da Nang Hospital. Addressing the meeting, Deputy Prime Minister Vu Duc Tam asked relevant agencies to continue applying accumulated experience in COVID-19 prevention. Drastic measures, including those utilized in handling large hotspots like Hanoi's Bac Mai Hospital, should be adopted. He said that the role of the epidemiological investigation and collaboration among the police and army in determining the source of transmission were extremely important. The Ministry of Health was asked to take samples for testing with the deployment of test kits manufactured in Vietnam. The Ministry of Health has sent experts to Da Nang to help contain the outbreak and help track the source of infection. A lockdown order would be imposed on the 3 hospitals, like the one applied on Bac Mai Hospital in April. The ministry will provide utmost support for the city in the quarantine, treatment, and tracing the source of infection. To prevent the spread of the disease, experts suggested all people who return home from Da Nang and are linked to the 3 hospitals must be quarantined for 14 days, while those returning from the city but are not linked to the hospital must make a health declaration. They also said that it was essential to impose social distancing in Da Nang City. Nguyen Man Hung, Minister of Information and Communications, called on local governments and residents to collaborate in completing electronic health declarations via the nCoV and Blue Zone apps. Over the past weekend, 3 residents in Da Nang and 1 resident in Quang Ngai were confirmed positive for SARS-CoV-2 virus. They are patients number 416, 418, 419, and 420, of whom patient 416 and patient 418 are in severe health conditions as they need ventilators. A further 11 patients were recorded as positive on Monday evening, bringing the national total to 431. Another update, Alma, airlines are to increase flights to transfer passengers from Da Nang. Local airlines have announced they would increase flights to support passengers traveling to and from the city right after Da Nang restarted social distancing measures on Sunday, as 4 COVID-19 patients were found in the coastal city over the weekend. The airlines also announced policies to support ticket exchange for passengers in the city, one of the most popular tourism spots in Vietnam, which resumed tourism activities earlier in July. According to the booking data of the local airlines, from July 27 to July 31, the number of passengers expected to arrive and stay in the city could reach 80,000. There are now 11 routes from domestic airports to the airport, with approximately 100 one-way flights per day. On Monday, the director of the Civil Aviation Authority of Vietnam, or the CAAV, Dien Viet Tăng, told local media that the CAAV requested all airlines in the country to increase flights to and from Da Nang. To ensure the safety and health of passengers and the community, all the airlines will maintain disinfection of the entire fleet of aircraft, as well as implement measures to conduct health checks. The flight crew are equipped with masks, gloves, and alcohol wipes, while passengers on the plane are required to wear a mask during the flight. Back to you, Alma.
All right. Thank you very much, Eliana, for your updates there in Vietnam. Stay safe and stay healthy.
Stay safe too, Alma. Thank you so much. Reporting live from That in Vietnam. This is Eliana Faith Sebastian. We live in interesting times.
In Malaysia, the health